Some new numbers from the CDC are showing more people are landing in the hospital, especially with flu and other respiratory illnesses. Hospitals say beds are filling up faster, staff are stretched thinner, and the surge is testing how the system responds. So the data shows roughly 3 in 4 hospital beds are currently in use nationwide, leaving a lot less flexibility when emergency rooms are seeing sudden spikes. The CDC estimates about 120,000 hospitalizations from the flu so far this season, and the weekly numbers are continuing to go up and up. And ICU occupancy is hovering nearly 70% nationwide, meaning hospitals have limited room if critically ill patients see a surge at any time. At the same time, in fact, let's look into more of this with Dr. Earl Stewart with Wellstar Health System. Dr. Stewart, it's always good to have you on. Welcome. Let's first talk about those numbers that I just mentioned from the CDC. What stands out to you the most?
Well, I think what is most concerning, Jonathan, and great to be with you this morning, is your point that the numbers are going up and up. This flu season is really predominated by the H3N2 variant, subclade K, that is causing the so-called super flu. We don't want anybody hospitalized with the flu. We don't want anyone hospitalized at all. But when we see that there's inadequate vaccine uptake, and even the vaccine that we have available is not always efficacious against current strains of the flu, we see more hospitalizations and more complications from influenza-related illness. So our goal is to protect individuals and the patients that we see from that.
Yeah, and speaking of the hospitalizations, some people can just treat it at home. Some people end up at the hospital. How do hospitals decide who needs to be admitted versus who can just be treated and sent back home?
It depends on the severity of the symptoms. So the most common symptoms that we see with influenza are the typical flu-like symptoms that just about everybody knows, which includes high fever, cough, muscle aches. In more severe cases, individuals may experience prolonged fever greater than 3 days. They may also experience significant issues with chest pain, even a pretty significant productive cough, even lethargy. But what hospitals have to decide is based on a patient's underlying medical conditions. Are they immunocompromised? Are they individuals with cancer on chemotherapy? Are they individuals who are diabetic, that specifically if the diabetes is not well controlled, that makes individuals more susceptible to more severe forms of influenza-related illness. And so oftentimes those individuals, including the elderly, who have weakened immune systems, and children who have weaker immune systems than adults, oftentimes when they have severe flu-related illness, require hospitalization. And those decisions are usually made when those patients present to emergency departments.
Yeah, and I want to ask you, when those hospital beds start filling up quickly, which we are seeing even here in Metro Atlanta, what changes do the hospitals have to make quickly?
Well, staffing is an issue, right? We have to call in more staff. That's always a significant issue during this time of year, especially during flu seasons that are very rampant, and when vaccine uptake may not be as good, or the efficacy of the vaccine that we do have may not be as good. But we do know that vaccinating patients against influenza and offering it an increased uptake may not necessarily keep individuals from getting the flu, but it helps to keep individuals from getting really severe flu illness. And so hospitals are already strained, right? And so during this time of year, to sort of help curtail that, we want to make sure that we do everything that we can in primary care to make sure our patients receive the vaccine, and to make sure our patients understand the importance of vaccine efficacy.
All right, we've got about 20 seconds left. I just want to get a final message in for families. What do they need to know as this surge is continuing?
Get their vaccines, practice those public health measures, frequent hand washing, wearing masks when appropriate, and especially have conversations with their doctors, their pediatricians, if they're immunocompromised, about receiving doses of antivirals like Tamiflu, if they fall within the category where they can receive that for preventive purposes.
All right, Dr. Stewart, thank you so much. We appreciate your time this morning.